I'd like to start with a question pertaining to our series title, Insist. Why is it essential for patients to collaborate with their providers on care treatment decisions?
So collaborating is so important, right? I always tell my patients this is not a dictatorship, right? This is a collaborative effort where I am here to guide you, but you are the captain of the ship. You are the one that needs to make all of the decisions, and I'm here to make sure that the ship goes in a smooth direction. So making sure we have open lines of communication, that the patients and their caregivers feel comfortable talking to me and my team, and also vice versa, and that we trust each other. It's so important because we are going for a marathon, right? We're not going for a sprint. This is a long-term relationship. Whether we're treating you for cure or we're treating you with palliative intent and it's treatable but not curable, we're going to be following with each other for a long time.
Lung cancer healthcare team, of course, consists of a number of different providers. Would you tell us about the various members on a team?
Sure. So there is, there are the people that do the scheduling that make sure that, the CAT scan is scheduled, that the MRI is done, your chemo gets scheduled, all of that. The schedulers are super important and an integral part of our team. And then we also have our office coordinators that answers the phone calls and, passes along the messages and assists with scheduling and sort of sets expectations and is the face of the practice. Then you have an office practice nurse or our oncology practice nurse who is, the doctor's right hand, making sure that the patients get proper chemotherapy, teaches, making sure that they understand about possible side effects, risks versus benefits, making sure medications are up to date, assessing symptoms. They are sort of like the front line. When it comes to any patient call, they're triaging and they're escalating or de-escalating. That would be the office practice nurse. And then you have an advanced care practitioner, an APP, like you either have a nurse practitioner or a PA that's working with you, that's sometimes seeing patients independently, sometimes putting in chemotherapy orders, really serving as almost as another doctor. If for some reason there's, something that the doctor's not available to do, the doctor needs in a pinch, or my patients that are almost at long-term follow-up that are doing great, that are just kind of coasting, I will share with my NP and make sure that, they know her just as well as they know me. And sometimes there's a fellow or there's a resident or there's a med student that's part of the team as well, because, see one, do one, teach one. It's really important to teach those that are coming after you and serve as mentors and really include them in part of the team and part of the decision making. Yeah. And then you have the doctor that just kind of oversees everything.
Of course. How would you define treatment goals for people with lung cancer?
So the goal of treatment, I think, is really contingent upon someone's stage. But it's also contingent upon what's important to the patient, right? So we have patients that are, stage 1 all the way to stage, 3C that we treat with intention to cure. And patients that have stage 4 disease, it's treatable but not curable. So I am very transparent with that as long as I have the information to have that discussion. But that being said, there are some patients with stage 3 disease or stage 1 disease that don't really want treatment and want to focus on quality of life. And that's okay too. And in which case, at some point their cancer will likely progress. How quickly or when that will happen, we don't know. Could they pass from something else? It's possible. But, you really need to talk about what's important to the patient because it's not always cut and dry.
As you mentioned, Dr. Preeshagul, there are several different support members on a team. What would you say to patients or even care partners who can sometimes feel like they're bothering their healthcare team with their questions and comments?
So we do get that concern a lot. And I always say, I'm here for you 24/7. And if it's not me, it's someone that's just as qualified to answer your questions no matter what. And I would rather get a phone call at 3 a.m. than get a phone call at 9 a.m. and it's, you need to go to the hospital right now, or God forbid something happened. I get a phone call from someone in the ICU that you went overnight and terrible things happened. So I want the phone calls to come through to keep you out of the hospital and keep you from going south. So call me. And I don't try to outline contingency plans or criteria of what would warrant a call, because then you end up getting in trouble. I always just tell my patient, think about how you're feeling now in front of me. If you're feeling any different than how you feel at this very moment, call me.